Okay.
Okay, good evening, everyone. We are trying to get Dr. Melanie and hope she can find her earpiece so she can hear us and call us back on the Diana Wright Show. This is the 8 o'clock hour of the show. Lots of things going on in the news today. The Voting Rights Act is under attack, basically, because everyone is saying that Chief Justice Roberts has gotten what he was put there to do, to kill things for minorities, and he has mission accomplished, as one person. And some people like John Lewis is saying that this is a dagger in the heart of the Voting Rights Act. So I'm not so sure if we should start worrying, but my suggestion would be that people will begin right this minute to start getting your photo ID. I don't care whatever hoops you have to jump to get it. Get your voter ID intact before 2014, and if you're going to wait until 2016, because a lot of people don't vote in the midterms, in 2016, wow, you can then go ahead and try to get your ID by then, because you have a long time between now and 2016. So whatever you need to do to get your ID intact, one that they will accept, especially if you're in a place like Texas and Mississippi and all those southern states and Florida that are trying to steal elections and trying to draw lines and make sure that people can't vote. You want to go out there and make sure you have your voter ID, which is a driver's license, something with your picture, that is a government ID, before 2016. I guess the fight just starts all over again. And should we kind of think that that all is well since 1964, 1965? Or are we just kind of living in a delusional world that we really are? The fact that President Barack Obama is black, does that really mean that all is well? I'm not so sure about that. All is not well in the United States of America. So as we welcome you from around the world and in the United States, we just have a few questions that we'd like you to mull over in your mind. Like, do you think things are really, really better since the 60s and 2013? Why is it that so many Republicans are so happy today, now that the Voting Rights Act has been kind of really struck down but passed to the Congress? The same Congress that does nothing. So why do we think that this Congress is going to make a move and do the right thing? Why do we think that? Do we really think that, or are we just kind of in a delusional phase? And Paul Ryan just needs to get his act together. He was being asked about the extradition treaty between Russia and the U.S. Do we have one, Mr. Ryan? And also he's trying to blame President Obama for Snowden to have access to all this information that he has. But isn't it the Republicans that kind of privatized all this stuff so that the NSA has to give all these contracts to all these companies, and then there's another company that actually gives the clearance that is private also? I'm not so sure what's going on here. I'm a little confused about all this stuff. And I'm truly wondering if the Republicans are serious. Because you see that in Texas today, they were so joyful, they said we should put this thing in action immediately. Voter registration ID. Why are they so happy? Why are the Republicans so joyful? If they're joyful, you know that something is not right. Okay, so we're going to try for Dr. Melanie again. Hey, Dr. Melanie, how are you? Are you there this time? Can you hear me? Okay, Dr. Melanie, can you hear me? Can you hear me? Okay, I thought you went to get an earpiece. Don't you have any kind of earpiece, headphone that comes with your phone or anything like that you can plug into your ears so you can hear me better? That would be a good thing. Okay? So I don't think she's hearing me. I'm not quite sure what's going on her end, but I hope she can hear me, and I hope she will try to get an earpiece. An earpiece comes with all smartphones basically, and I'm just using a little cheap one here that I got from somewhere. I don't even know. And it's so old too, but it's good. I still hear clearly from it. So let's hope Dr. Melanie get her earpiece and she can join us, because we have some great questions to ask her this evening, and she promised to have given us. Can you hear me now, Dr. Melanie? Oh boy, she's looking at me very blank, and I'm not quite sure what's going on. What is going on? Okay, I'm not quite sure. But anyway, we'll get it sorted out as we continue in the program. If she can hear me by just listening to me on her computer, then she will know I'm asking her to try to get an earpiece to plug it into her system so she can actually hear me clearly. All right? And then things will be better, because we don't want her not hearing the questions that come in by phone. Last time she couldn't hear what the person was saying and all that. So I wanted you to kind of think about the Voting Rights Act. What does it actually mean to each and every one of us? Okay, I guess she's calling in. Hey, Dr. Melanie, I know this must be you.
Yeah, good evening. I'm so sorry. I'm having some problems with my Skype account. I don't know what's going on.
Okay, and I also wanted you to know that you could use your earpiece for your iPhone to plug in, and so you could hear. You could plug it into your iPad or your iPhone or whatever instrument you're using on Skype, so that you can hear me clearly. Yeah?
I finally found my iPod earpiece, but it's so tangled up it'll take me later.
That's not a good thing. Okay, anyway, so let's then get started here, because I'm kind of challenging my audience to do a lot of things in terms of the Voting Rights Act that was kind of struck down today, and Section 5 especially, that everyone is ranting about, and everybody's mad, and everybody's saying, whoops, 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 hold up. The Supreme Court justices vote, which is 5-4. We know the split. We know there are 5 conservatives. And Clarence Thomas, please stop stressing about Clarence Thomas. Don't you know who he is? He is not going to vote for anything that has to do with black people. Okay? He benefited from affirmative action, but he will want to take it from your child. So, why are we trusting over him? And he's now talking about, he's comparing affirmative action to slavery. Oh, stop, please. No time for Clarence Thomas. Okay, he needs to go drive his RV and go cool out somewhere. I mean, because he just makes no contribution to the race of black people or minorities in this country. So I don't know why everybody's so shocked that, he didn't go with the radicals. They're calling them. I mean, anyway. I want to get to some health issues. I don't know if you had a chance to remember the name of the HIV pill that is claiming.
It's called Truvada, Truvada.
Truva.
C as in Tom, R-U.
Uh-huh.
V as in Victor, A-D-A, Truvada.
Truvana.
Truvada.
Oh, Truvada. Okay, Truvada. Whoa, what a name. Truvada? Okay, that makes it true that it can help us with the HIV thing. Okay. All right. So that's the HIV prevention pill that we spoke about last week, and Dr. Melanie said she was going to remember the name and let us know today. So it's Truvana.
Truvada. T-R-U, V as in Victor, A, D as in David, A. Okay,
Truvada. All right. Okay, we think we've got it. So it's Truvada, okay? So for those of you who are, encountering risky behavior, you might want to check out Truvada, yeah? Since they're saying and giving it great credit, 50% of those who are taking it, we gather, Doc, is actually not getting the infection of the HIV virus. Am I correct?
That's the report. It's better.
Okay, that's what the data says anyway. Okay, all right, let's slip into some other stuff here that we have. there's something called FTD. F as in Frank, T as in Tom, D as in Diana. Frontal. It's something to do with dementia. And it says that this particular type of dementia, FTD, changes your personality only, especially for people who are in their early 60s. Are you aware of this particular thing, and how do we kind of, realize that our older people, moms, dads, relatives, whatever, is having this FTD?
Mm-hmm.
Frontal temporal dementia.
Yes. So the frontal lobe is kind of your thinking cap of the brain.
Mm-hmm.
And, in terms of mood changes in behavior, that's controlled by your frontal lobe. So oftentimes with patients who have Alzheimer's,
mm-hmm.
They tend to notice that a lot of people can have pre-senile dementia. So they're not fully in dementia in many cases, but they tend to appear probably around their 40s, mid-40s to about mid-60s, despite the gender. And social and personality changes in behavior are usually what you notice.
Okay.
There is no cure for it, but, there's some treatment options that are available.
Okay.
And with any family member or anyone that has dementia or is at risk of becoming a patient with dementia,
mm-hmm.
You always have to think about their safety. That's the most important thing when you think about somebody that has social and behavioral changes,
mm-hmm.
how their behavior will affect people around them that are considered normal. And then, of course, someone who was previously normal that's now considered to have mild dementia or, personality changes, that can be very, very much a negative connotation for that individual, because in many cases they become more dependent
mm-hmm.
on someone, and a lot of times that can create a lot of depression in some cases in a lot of these patients.
Okay.
So that's what FTD is, frontotemporal dementia.
Wow. So in the 60s, so my goodness, that is kind of early, because what they're saying now 60 is the new 40. So I'm not so sure. This is something that we want to. Is there anything is there anything that you can do as an individual to try to prevent this, or no?
Usually B12 and folate are two of the most important things or features that you want to think about, because, once a patient presents with personality changes, you always want to make sure you check their thyroid levels. You always want to make sure you check for a B12 level and also folate level, and you also want to check to make sure this person is not somebody that previously had syphilis and now is experiencing dementia. And of course, if there's a family history of, for example, Alzheimer's, then it kind of predisposes that person or it puts that person at risk of most likely developing dementia. But there are multiple forms of dementia because, some dementia can occur because of a stroke.
Why is it that people who have dementia or Alzheimer's, if you will, is that the same thing, Alzheimer's and dementia? Is it interrelated, same thing?
It's actually called Alzheimer's dementia.
Okay. All right. Why is it that it seems that a lot of people who have dementia, Alzheimer's, whichever you refer to it as, tend to get violent? Because I see that in a lot of people that I know that have parents, they become very violent, which was not necessarily their personality prior to.
Well, it's kind of like, you can look at it this way. If you think about someone who's bipolar, somebody who's schizophrenic, all these different mental diagnoses that people can carry, someone becomes demented, it can be associated with them becoming psychotic. So they don't have to be psychotic where they have visual hallucinations or auditory hallucinations. So they either see something that's not really there or hear voices or things like that that they'll report.
Mm-hmm.
So in many cases, these patients, they have chemical imbalances, and that's why their personality changes. And of course, that's the purpose of medication, is to suppress this type of behavior, or basically allow the patient to maintain what's called normalcy despite their diagnosis. So as long as there's a chemical imbalance, the behavior that you don't desire is usually what actually manifests. And so unless you get to the root of the problem, by intercepting various pathways that lead to these medical conditions, there's no other real way to control the behavior. And then you have to distinguish somebody who has delirium versus somebody who has dementia. Because in delirium, it occurs quite suddenly. So dementia takes, it's kind of progressive, so over time you'll notice changes in behavior that start taking place. And with delirium, for example, an elderly patient who has a urinary tract infection that was not treated, or that was caught late, basically, because of late presentation, can all of a sudden have a significant change in their personality, and it's because they've developed what's considered urosepsis, so now their bloodstream is affected by whatever organism has contaminated their urine, and their behaviors can change.
Wow.
So you always want to differentiate. Does it occur within a really short period, let's say less than 24 hours, versus kind of a progressive behavior?
Okay, one of the things I hear a lot of people I know that have parents that have dementia or Alzheimer's, they seem to think that none of the drugs that they're taking actually work or help. Is it because they're trying to or hoping that the person will turn around and so they kind of get impatient, or is it that the medication is really not at the level yet where we can say, here is a pill that you can take, or here's a patch or whatever that if you have dementia, you can be better?
I don't necessarily want to agree to say that it's because the medication does not work, but I think one of the biggest concerns with regard to the medication is that a lot of times when people take medications, they anticipate it's going to work this second. So as soon as I put it in my mouth, down my throat, it's going to get that effect right away. And if you think about medications for people who have, various mental disorders, whether, let's say you're complaining of depression or anxiety, there are drugs that acutely will work within some cases 30 minutes to an hour. And then there's some medications, it takes several weeks, some cases a 6-week period or even 4-week period before you actually notice any changes or improvement in the behavior. And so a lot of times you have a situation where the family members, they're a little disgruntled in many cases because this is somebody that who you have not seen this pattern of behavior before, and so you want to help that individual. And in wanting to help that individual, once their personality or their behavior takes a while to transition to what you consider normal, it's very difficult to be really accepting of kind of where that person is now. And so in many cases you have, family members who become really frustrated, and you can only imagine that the person who's actually the one that's considered the victim, if you will, or the patient, they themselves are having a hard time dealing with this change in behavior, because I have an example of a fairly young patient. I mean, he's in his 50s, but for me that's still very young. And he suddenly, within several weeks, started having, mild tremors of his hands and also his legs, and then he started to develop what they consider a shuffling gait, so they're kind of shuffling along. And then he noticed his memory started to change.
Oh.
And so...
That shuffling along is when someone is walking and pulling one foot behind, right? Is that because I see a lot of elderly people walking like that? Is that what you're talking about?
It's similar to that, but if you can imagine that they're not really picking their feet up, it's kind of like they're just shuffling, along. And so Parkinson's disease, usually, that's how the patient presents. And of course, Parkinson's is associated with multiple personality changes that can occur there. So with regards to kind of a patient in this situation, family members, the main thing is that they have to be understanding, they have to be patient and be supportive. That's the best thing you can really do, because you're at the mercy of really prayer and hoping,
yes,
this medication that's given to your family member or someone you care about will actually work. So there's no guarantee of anything, but of course, multiple studies have been done, multiple testing on these drugs to ensure that they would be effective and they will actually do what it is that they are supposed to do.
My special guest inside the Diana Wright Show at the 8 o'clock hour this Tuesday is Dr. Melanie Simpson. She's a general practitioner, and she's right here in Florida, in West Palm Beach. And, it's kind of weird, though, because I guess people think of dementia as old people's disease, if you will, and you just spoke about someone who was in their late 50s. And then, it's like, okay, every medication that I try doesn't work for that person. What can I do? Because we all going to get old. So, it's like, this is something we'll need to think about. Not we're necessarily all going to get dementia, but is there something in our diets, or is this hereditary? Because I know of one lady who was normal, everything in her 60s, and went to the mall, drove herself to the mall, and everything was wonderful. And when she came out of the mall, she couldn't find her car. She just got totally not knowing where she was. And the good thing is that she actually remembered the number to call someone to come and pick her up. And only to find out that her mom had dementia in a very severe way. So is this a hereditary thing, or is it not?
I'm sorry about that. It actually can present a lot earlier than, what's considered typical. And, the typical age is usually over 70. In most cases of when people would kind of consider that someone, if they presented with dementia-like symptoms, that it would be considered a little bit more acceptable. But, dementia, no matter what age, is not really something anyone would look forward to. And, like I said previously, someone can have a stroke or a series of mini strokes, and that can also present with them ending up with what's considered vascular dementia.
Okay, so it's not necessarily hereditary. It can happen because of several other factors.
No. Okay. It definitely can happen because of many, many, many factors. And one of the big issues is that a lot of people are so depressed these days, so we have a lot more, people being diagnosed with depression, and that actually has been thought to be associated with early onset dementia in many cases. So cortisol, your stress hormone, usually gets released, and if you have really high levels of cortisol that's kind of circulating around for long periods of time, then the hippocampus, which is an important part of the brain, can actually burn out. And that can lead to, many, many problems, because the hippocampus is actually the site that I would consider the powerhouse, or the tower that's responsible for learning and short-term memory.
Right.
So with early stage dementia, it's presentable in some people in the sense where people often forget things that happened. They forgot what they ate for breakfast. They forgot what they just said to somebody. They forgot where they just came from. You know what I mean? They forgot who they were temporarily. And it's so necessary to realize that paying attention to each other every day, especially people that you're around on a regular basis, is so important. Because you definitely will pick up subtle changes. If you really spend time paying attention to the people that you are associated with on a daily basis, you will notice changes. And that's why, someone can come to you and say, well, last year you weren't really like this. I mean, everybody changes all the time, but you understand what I mean? So being able to pick up on really subtle signs is really important. But one of the big difficulties with dementia is that for them to perform an actual task, it takes a lot of thought. It's almost like a child trying to learn how to count to 100, and they get to, let's say, 20, and they can't think, okay, add 1, add 2, add 3, and keep going up. And they turn around and they start over. You know what I mean? And it continues. And that's kind of how a lot of demented patients present, because, and I don't want to say demented, because when you think demented, you think more of somebody who's kind of psychotic to some degree compared to someone who has dementia. So I'll correct myself on that. But there are medical conditions that can lead to it, like Huntington's disease, which is hereditary, multiple sclerosis. There can be infections of the brain, like HIV, AIDS, Lyme disease, Pick's disease, and, brain injuries, brain tumors. Somebody who chronically uses alcohol can develop what they call Wernicke's encephalopathy, where they really cannot function. And then low B12 levels, like we talked about. And there's something that's called normal pressure hydrocephalus. Basically, hydrocephalus has to do with the swelling or increased pressure in the brain, so that there's fluid that develops in the brain, and sometimes there can be a shifting of structures in the brain. And also, medications can do it as well. So there's a lot to consider when you think about having dementia.
Okay, you mentioned depression, and I wanted to kind of look at depression in young people, like in teenagers, and and depression in older people. How do we, is that the same type of depression, or is it a difference in depression between young and old?
Well, depression can unfortunately be manifested at any time and any stage really in life for a lot of people, because there's so many environmental factors that influence kind of where people are. You have students comparing themselves with other students who think less of themselves than they should. Then there's family dynamics. Nobody knows what's really going on at home. What the stresses are there in the home. And also, you think about job loss and many things that can affect the young people. And so one of the big things with our young people now is there's a lot of experimentation with drugs. And so that's a huge factor, because if you think about it, somebody at 16 is addicted to an illegal substance, let's say crack cocaine, just to be, giving an example.
Right. Then
if that person is unable to maintain that habit, they can fall into a severe depression. But not only that, their behavior in some cases can become quite aggressive too, because of them needing to get that fix. And so when they have time to look back over their lives or the decisions they've made, in many cases, severe depression sets in, and oftentimes you'll hear, people turn to alcoholism, in some cases, and then you have a lot of people who find other things that are not considered creative or productive as an outlet to be able to kind of escape those feelings that they're having. But I seem to be coming into contact with a lot more young people who are actual addicts of some substance or another.
Okay, I want to stay with depression for a minute, because I want to ask you, if someone is just blue for a day or two, or that kind of thing, because I think most people do get blue, if I must say that. When do you kind of figure out that, hey, this is not just me being blue, this is me being depressed, and I need to go get some help?
Well, this is a really good question, and I'll tell you why. Because Because many times, a lot of us do have those moments where you have uncertainty and you do feel sad. And I think a lot of times we don't give ourselves the opportunity to be sad over something, that occurred or something we don't have any control over.
Right.
And I think because we don't do that, there's kind of like this facade we put on and, we kind of play the role very well, and while we're busy acting the part, inside you're actually crumbling. You really haven't dealt with what it is that's at hand. And there's nothing wrong with someone who has to have medication intervention in order to actually function appropriately the way they need to. You understand what I mean?
Yes.
But the fact of the matter is, unless you confront what's really going on with you, you really cannot get the help that you really need. And many times you have people who have those feelings and say they're sad, but at the same time they kind of are thinking in the back of their mind, well, what is, a family member going to say? What are my friends going to say? What are people going to think when I tell them I'm taking the Zoloft, or I'm taking Celexa, or I'm taking Xanax because I'm anxious, or, whatever the case might be. But you have to remember, it is about you functioning 100%. That's important. And if you're not able to function 100%, then there's no way you're going to really maximize your potential and really be the best individual that you can be, because you spend all day being depressed. Sometimes chronic depression can be because of chronic pain. So, you have a lot of people that are on pain management medications because they have significant pain symptoms, maybe from a car accident or spinal injury or something. So that's something else that we have to think about. So there are a lot of factors that can really affect someone coming forward to actually get the help they need for the feelings of depression.
Okay, my special guest inside the Diana Wright Show at the 8 o'clock hour. We're live, and my guest is Dr. Melanie Simpson. She's a general practitioner, and we welcome you from around the world and in the United States, and thank you so much for joining us this evening. We are staying with depression for a minute because I think we need to reach out to people, because as Dr. Melanie said earlier, that there are so many people who are so depressed these days, and I just simply want to know, because I get up sometimes and I just feel blue that particular day, but it lasts for a few moments and I'm gone, like I like to think of it as, okay, you have a half an hour to deal with your pity party and just come on now, let's go. Right?
Well, you know what? I love that you said something of that nature, and I'll tell you why. We handle situations differently. So I could just get some really bad news about something, and I could completely fall apart and not be able to function for the next 30 days. And then somebody else can hear the same thing and not be able to function for 24 hours. And then somebody else could hear it, and within a half an hour, they're good. You know what I mean? It depends on your level of maturity in terms of complex problem solving. And so in some cases, there's some people that no matter how many times they've been down that road or experienced that particular challenge, whenever they get to that spot, they always stop and they're stuck. So learning how to overcome certain challenges is very important, and having a support system, that definitely more than anything is beneficial. And a lot of times you have people who will tell you, oh, I feel suicidal, but I'm not really going to kill myself. Well, the thing is, you can continue saying that, but eventually the behavior might actually take place where you actually take your own life, because deep down you really felt suicidal, but with your mouth verbally you're saying something different. So there's conflict that's occurring between your internal self and your external person. And until those two meet in the middle or overlap, whichever way you want to put it, there's always going to be that risk where you're kind of teetering on the fence, and it's a very dangerous place to be, because for someone it can take just one small thing to drive them over the edge.
Yeah. Yeah, because I want to get to that, because, I think of people in relationships and when they break up and how that actually can drive some people to the edge, that they'll actually go try kill the person. That we've seen a lot of that in Florida and around the country, where someone believes that if I can't have you, then you're going to die. Okay? And even though if the person dies, they're going to be in prison anyway. How is that something that says to me, okay, that person was just not able to handle their emotional issues, which is basically, I guess, being depressed about the fact that you've lost that person who you thought you were going to be with or marry or whatever the case is, and now they're gone to someone else. So let me just kind of finish them off, and no one gets that. We see that with Jennifer Hudson's in-law, brother-in-law. We see that with lots of people here in Florida. I am just sick and tired of seeing that on television play out. And I'm going, okay, if someone doesn't love you, my God, why do you want them around? Just tell them to go.
I agree, but you know what it is? A lot of people have a hard time actually dealing with rejection.
That's the word, rejection. Okay.
Yes, anybody would have a hard time dealing with rejection. I mean, I don't think I would appreciate being rejected by anything or anyone, but the fact of the matter is, everybody does not like everybody. And I feel bad to say that because it shouldn't be that case, but I mean, it's really true. Everybody doesn't like the same thing. Everybody doesn't like everybody else, and I think it was Joan Rivers that wrote a book. I hate everyone or something. I hate everybody something. Some book she wrote fairly recently, and they were interviewing her on one of those shows, and they asked her, "Why would you write a book like that?" And she's like, "Well, I'm bold enough to tell the truth," and we already know she has quite the mouth. But the fact of the matter is, there are many things that other people may not necessarily like in terms of your behavior and your level of reasoning. And so because of the differences that we have, we tend to react to the differences in people. And many times, the things we don't really, how do I say this? A lot of times the things that we tend to critique in other people are things that we admire in that person that we want for ourselves, but as a defense mechanism, we turn it into a criticism. Does that make sense?
Okay, and I don't want people to think that it's just about male and female relationships, because this happens between friends, it happens in gay relationships, it happens in all types of relationships where people are simply not wanting to share the person with anyone else. Yeah?
Well, I would not want to share anyone with anyone else either. However, I do not, under any circumstance, value myself to be, or put it this way, I place high value on myself, and so I don't look at somebody else's life as being less than mine. And if I'm unhappy with who I am, then I need to do some deep internal searching and figure out what the challenges are in my life that's causing me to have these low feelings, in my life. And in a lot of cases, you have people that as they go through life, they tend to beat up on themselves and they're never forgiving of themselves. And so we sit and we play the blame game and we play the victim role and, you do all these things. But that's manipulation. That's the other part, is that many times that's manipulation because, a lot of times women or men figure, well, if I say this or I do this or I act this way, then, it's going to change the person's mind. Well, the only person who can change your mind is you. Somebody else can't change your mind for you.
Yes.
They might influence your decision, but they cannot change your mind for you because you own your mind. And so if you say to yourself, you know what, I'm valuing myself much more, like you preach on the show, I Love Me, then the more time you spend understanding who you are and appreciating yourself, you will place such high value on yourself that, as T.D. Jakes says, if somebody comes to you and says they want to walk out of your life, let them walk.
Exactly. Okay, all right. So we're reaching out. I'm reaching out to all the people who might be depressed, whether you're blue for a day or two. My method is to just stop the pity party quickly and move on, because if you continue in that pity party, you only seem to get worse in your depression. Yeah. And
I think you gave me an excellent idea for a project I'm working on.
For what?
A project that I'm actually working on. You're talking about depression.
Oh, I didn't get that, Doc, because I hear a lot of shuffling in the background. What did you say about that?
Oh, I'm sorry. I was saying, you actually just gave me a brilliant idea. To put forth in a project that I'm working on about depression.
Oh, wonderful. Oh, I didn't even know you were doing that, and I just decided to talk about depression. Okay. All right. So seriously, because a lot of people, they have a pity party, victim mentality. Even with the Voting Rights Act today that the Supreme Court justices kind of struck down and stabbed them in their hearts and all that kind of stuff. In my opinion, your revenge to all of that is go out, do what you must, get a voter ID. So when the election comes in 2014, you have lots of time between now and November 2014. And then there's a lot of time between now and 2016 in the next presidential election, which is when most people do vote. A lot of people just don't vote in the midterm elections anyway. So you have almost 4 years. Just do that. That's your revenge, to go out and get yourself the ID that you need. Whatever hoops they want to put you through, you find a way to get that ID and go vote if that's what you wish to do. Okay? So, because just like if a teacher says to a child at school, you are going to be no good and you're this and you're that, your revenge against that teacher is to show the teacher you're smart and you can go home and study and you can get an A. Yeah?
Well, you know what I tell people? The same effort, and I mean, it might sound cruel in some cases because, people take things differently. And, I tell people you cannot bask in the sad moments of your life all day long. Because guess what? As you're basking in those sad moments, you're losing time that you can create positive things in your life.
Exactly.
You're losing time you can spend focusing on positive things that'll actually create balance in your life. And so it's like having a checking account. If you're always busy withdrawing and you never deposit anything, well, one day you're going to go to the bank and you're going to
there's nothing to withdraw.
There's nothing there.
Okay, and I want to make a point here, Doc, because a lot of people, when you're talking about these things, they're like, oh, Diana, you don't have any problem. Everybody has sad days. Everybody has problems. I don't care how much money they have, how much wealth they have, how much fame they have. They have sad days. You might not.
I'll give you an example. So, I don't know if it's because I'm in medicine. I don't know. Maybe that's a part of, the resilience that I seem to have in certain situations. But, I have my own personal struggle right now that I'm going through. So last night I got a call that my mother developed a bowel obstruction. So basically she was not able to go to the bathroom. She got a swelling or distension of her abdomen, was vomiting, the whole 9 yards, and had to have emergency surgery.
Right.
So here it is, I'm thinking, okay, so my mother is currently out of the country on vacation, Jamaica, this is going on, and I'm here, and I have to take care of patients, and I have to be focused. Now I can do one of two things. I can either say, obviously I'm going to, make sure she's okay, but I can say to myself, oh my goodness, why is this happening to me? This does not make sense, and, I have all these things going on, and so many other things to focus on. And then you have patients who come in who have emergencies that you actually have to take care of that are right in front of you. So my point that I'm trying to make is you have to balance everything that happens in your life, and you have to take things many times with a grain of salt. It doesn't mean you're not giving priority to something, but if I'm busy focusing the whole time on what's going on with my mother, and I don't, take time to actually regroup, I will be of no use to her when I get there.
Right. Absolutely. Absolutely.
You have to have homeostasis or balance, which is what your body craves all day long, at all times. It doesn't mean you're not going to go, 4 degrees left and end up in a different destination, and then 2 degrees right and you end up somewhere else.
Yes.
It doesn't mean you're not going to have roller coaster moments in your life, but if you're always on a roller coaster, after a while you're going to be dizzy. So, it's important that we take time to regroup, take time to reevaluate. Like T.D. Jakes said, reposition yourself. There's some times when you just have to make necessary changes in order, even just changing your mind about certain things, about the way you feel about certain people.
Absolutely.
Whatever it takes to allow you to be in balance, that's really what we have to focus on, because there's some people that would hear that news and they would be in the hospital. You know what I mean? So it's just one of those things where you remind yourself that no matter how much you plan for life, it's just something that happens.
Yeah.
And you have to deal with where you are.
Amen to that. Amen to that. Okay, Doc. There's a lot of talk these days about sunscreen, and we should all be using sunscreen. It slows the aging process. How do you feel about that? And of course, they make sure they tell you that you need to use a broad spectrum sunscreen. What is a broad spectrum sunscreen, may I ask?
Well, sunscreen that's usually like SPF 15 or higher is usually good. And the reason why sunscreen is good is because, melanin is the pigment that actually allows the skin to turn dark.
Right.
So, a lot of people, obviously lighter colored people, they don't have as much melanin as, a lot darker people. And so because of that, we're at risk for cancer. So, there are water-resistant sunscreen, SPF 50, like you talked about. A lot of times people say, well, if I just put some lotion on, then I'm okay. Well, the sunscreen is kind of acting as a protective barrier, so that when the UV radiation hits the skin, it can cause significant damage and increase your risk of cancer. So the whole purpose of sunscreens is that they can prevent against ultraviolet radiation. And, you have different wavelengths that are shorter than visible light.
Right.
And those aren't invisible to the eye. So you have ultraviolet A, which is a longer ultraviolet ray, and it causes lasting skin damage. It causes aging, and it can cause skin cancer, whereas ultraviolet B is more like sunburn, you know what I mean? That kind of a thing.
Yeah.
And so, in terms of the broad spectrum sunscreen, it's going to protect against UVA and B. And that's primarily the reason why they recommend that.
Okay. Alrighty. Air pollution raises autism risk in pregnant women? I read an article about that, and I was a little kind of taken aback that air pollution can actually raise the risk of autism in pregnant women.
That's a new one for me.
Okay, yes, I saw it, and I thought I'd raise it to you and see if you can either give us some answers another time or something. Well, first of all, this is going to be our last show until I come back from hiatus, because I've done over 65 shows now, so I'm gonna be going on hiatus for a while. It takes a long time for a lot of shows to get to 160. Okay. Even 100. So I've done more than 160 shows. So we're taking a hiatus for the summer, and we're coming back in the end of August before the regular season for television starts, because it starts normally in the end of September, because they kind of wait until Labor Day goes by and all that kind of stuff. But I think I'm gonna come back before that. So this is actually our last program with you before we leave, because next week, Tuesday, I'll do the morning show only. So I just want to make sure I get some stuff out here. So air pollution. I know we'll talk about that when I come back. And here is something that I think is quite interesting. Before I get to that interesting something, does more sleep actually help people who are suffering from type 2 diabetes, in your opinion, as a doctor?
Can you repeat that question?
Does more sleep actually help patients with type 2 diabetes?
More sleep definitely would help anyone.
Okay. I just, I saw that and I just wondered, is it something that will actually, and they said especially men with type 2 diabetes, extra sleep will actually help them. So I just wondered because I figured we all need some more sleep. So
I think in general you have to look at it that, once your body has not had adequate rest, you're going to release your stress hormone cortisol. And cortisol is all about, creating body fat. Increasing your stress hormones and, causing an increase in your heart rate and blood pressure and everything else like that. And so because of that, those stress hormones that are released can cause your blood sugar to be elevated. So the need for sleep, whether it's for type 2 diabetes control or just maintaining normalcy in life, it's very necessary.
Okay. All right. I have a story for you, Doc. There's something called scrotal lymphedema. And I'm going to read the entire story and then you can come back and discuss it. Wesley Warren had a huge problem. Now he has a small but maybe equally vexing problem. Warren, who suffered from scrotal lymphedema, underwent a 13-hour surgery last year to reduce the size of his 140-pound scrotum. Okay? So when he awoke from surgery, he discovered that his penis measured just 1 inch because of that surgery. So he has to now go back and sort that problem out. So first of all, I wanted to ask, what is scrotal lymphedema?
One of the other names they call that is elephantitis.
Elephantitis. Okay, I got it now, because that's the term I knew.
So basically it's an obstruction in your lymphatic system. So your lymphatic system usually drains the body, prevents infections, from taking root in your body. And so if the lymphatics are affected, then you can only imagine how awful it would be for, any person to have to carry around that weight.
Well, I gather that he's trying to sell the 140-pound scrotum on eBay to pay his hospital bill.
I should have said to what, but.
Haha. And how is it that you can have surgery for one thing and your penis becomes short? How does that even? I'm like not understanding this.
Well, they usually have to do excision and like flap reconstruction. I mean, it's a very intense kind of a procedure because if you think about it, the scrotal sac is actually where the you have testes, scrotum, sperm. So if that whole area is affected because of significant amount of fluid, I mean, it affects the person's ability to reproduce or just to be even intimate, because how are you intimate with all of that swelling?
Yes.
It's not gonna, and in many cases, you have people that have had, like a cellulitis and inflammation of the superficial layer of the skin. Maybe they had cancer, maybe there was trauma, maybe there was injury. Sometimes there's STDs that can lead to that. So there are, many things that you have to consider. But the surgery is extremely invasive. I mean, you usually have to remove the entire scrotum and rebuild it with multiple skin grafts.
Okay.
And that's what the problem is.
Right.
And they try really hard to allow the patient to be able to maintain sexual function. So that's a part of the reason why the surgery is so lengthy as well.
Okay, I'm sorry for Warren. 1 inch, and then he has to go back now and go for another surgery to try to get it back to normal. Okay, so we wish for Warren great success, and we pray for him too. So anyway, here's another one. It almost sounds like a joke. Imagine how great it would be if your body couldn't store fat. Because, a lot of us want to lose the fat off our bodies. So there's a life-changing genetic condition that a cyclist has, and I think he lives in London. Okay, it's called MDF or MDP syndrome. It's believed to affect a grand total of only 8 people in the entire world. So what it does is signs of an inability to store fat on your body. Paradoxically, elevated fat counts in his blood led his body to believe that it is obese when it's not obese. And when I heard the story, I was thinking of people who are anorexic, who will look in the mirror and see that they're fat when they're really, really skinny.
Mm-hmm.
Are these kind of similar or equated together, or are these just two separate things?
One of the biggest things I want to say is everybody has to be happy with who they are. Mm-hmm. I would say that for starters, because, people tend to always compare themselves with other people in terms of body size, whether or not we realize it. Like a woman, for example, will say to another person, oh, you look like you're gaining weight, and you're trying to figure out, okay, is it because my face looks more round? Is it that my arms look a little bit bigger? Mm-hmm. But usually they're looking at breasts. That's usually how they figure out that somebody is gaining weight. Mm-hmm. You know what I mean? Or they think maybe someone's pregnant or something like that.
Right.
And so oftentimes we are concerned about self-image, body image. And so not wanting to have fat cells, that's nice and great, but fat also provides insulation. Mm-hmm. So it's a very necessary element of your body. In addition to that, it allows for padding. So I'm not saying to be extremely obese or extremely overweight, but, it allows our functions as a cushion in many cases. Because if you think about it, a lot of people who are extremely obese, they cannot really walk long distances, they can't really breathe, and they complain about so many things, and then, of course, the stress on their large joints. Right. But when you have a product, if you will, that actually is going to eliminate fat from the body, that's not really good, because you need cholesterol to line the layers of, it's like they cover the myelin sheet, which are in the nerves, that actually act as a protective barrier so you can have transmission of signals. So fat in the body has a lot of beneficial, important functions. Too much of anything is never good.
Yes.
So, it goes back to being in homeostasis and having balance. And there's nothing wrong with wanting to have a little less fat. So just watch your diet. Mm-hmm. Exercise. That's really what the best advice is. Mm-hmm. Is maintain a good diet and add exercise to that regimen. Right. So you can have a really good diet and you completely don't exercise and your muscles are not functioning properly, and they can atrophy because you're not using them. So, just simple things like walking. I mean, you can pace back and forth in your house as many times as you want to, or if you have stairs, or, you enjoy walking your dog or whatever, pastime you like that allows some form of exercise, even for 15 minutes a day, that's encouraged.
Okay. And we also learned in that same story that MDP syndrome actually led him to have diabetes. So, but he said that despite all of this, he lived a normal life, and he's actually training for the 2016 Paralympic Games. So, I don't know. Be careful what you wish for, okay?
I agree totally.
Seriously, because a lot of us want to be skinny, but if we're really skinny, we might just end up with a syndrome that we don't want to have. So fat insulates. Don't take all the fat out of your diet now. If you're trying to lose some weight, then fine, lose the weight and get down to the size that you want to be. But then you have to slowly bring things back and try to figure out how you're going to maintain that weight that you lost, okay? So anyway, Doc, sorry to hear about your mother, and I trust that you will be going to make sure that she is well and doing well. And she's actually on vacation, you said?
She is. Her surgery actually went well. I got a message, actually while I was talking to you.
Oh, great.
I got a message earlier because I contacted the hospital, but she's doing well.
Okay, great, because, you know, it's not a good thing to go on vacation and get sick.
I'm telling you.
Yes, that, you know, I mean, if you're in your normal life, you know, it's crazy, but when you're on vacation, that's even worse. So I'm sure you must have...
It goes back to the saying, life is so unpredictable, and you just have to be ready for whatever
comes your way.
That's your way.
Exactly. All right, Doc, as usual, we ask that you give us your final thoughts before you go. Dr. Melanie Simpson, my permanent Tuesday evening guest here to give you all the medical things that you want to find out about. We normally have her by Skype, but you know, technical things just kind of make things happen that you don't want to happen. But anyway, so you have to flow and find the best way to make it continue. So we still do the show, and we give her a chance to give her final thoughts before she goes.
I think my thought for today is going to be non-medical, but rather one of an inspirational sort. And simply always pray to have eyes that see the best, a heart that forgives the worst, a mind that forgets the bad, and a soul that never loses faith.
Amen. Great way to end the program, and thank you so much for that thought. I appreciate it.
You're welcome. You're welcome.
And I will keep that in mind. And I hope that your mom gets well and everything works out and everything is fine and she gets back safely, okay?
We appreciate it. Thank you. Have a good night.
Okay, Doc. Thank you so much. All right. So you see, no matter what's going on in your life, you can still function and do the things that you're supposed to do or that you're committed to doing. Doc could have said, oh, I don't want to do the program this evening because I have to make sure my mother is okay and all that kind of stuff. No excuses is what we do here. So we thank her so much for joining us this evening, especially under the circumstances, and also that the Skype was giving problems too. So you see, you just got to work around your issues and not get uptight and, you know, all flustered about things. Don't forget that tomorrow is indeed Wednesday and Dax will be back with us. He's back from Iceland, and we're going to talk about your wellness and how not to be stressed out. Just try to be well. Lose the weight and, you know, try the detox thing and make it work for you. Like I was talking to a lady yesterday, and I was telling her about the program and, you know, about the detox, 21-day detox by Wright Wellness. And she was like so anxious to try. And I said, no, I don't want to give you too many details. Just listen to the show. Tune in on Wednesday morning and you will hear Dax because he can tell you about it more than I can. And then if you're happy about it, then you want to try it because it really, really, truly works. So, you know, it's just a matter of doing things, giving things a chance to work. As Doc said, even if you have someone in your family that has dementia, it will take a time for the medication to go through their system and actually work. We want the microwave instantaneous. Everything we do in our lives, we just want it instantly. Yeah, some things I would like to have instantly, like a couple $1 million will do. We'll take that. A movie from my book, I'll take that. You know, instantly you want things to happen, but sometimes you just have to be patient and let deadly negligence be out there and work. Yeah? And help people to see that God is still in the miracle working business. So sometimes we just have to be a little patient. It's hard, you know, I know that it's hard because patience is not one of my virtues. But I'm getting better because it's something, as Doc said, you need to pray. Yeah? And let your heart just receive. So that's where we want to have you go this evening. And as you ponder your evening, and if you're depressed and troubled about something, just think about some good thoughts. Think about the better times. And the better times that can come tomorrow. Because tomorrow is a new day. CNN just started a show called A New Day. It's a new day. Every day is a new day for new things to happen, great things to happen to you, wonderful things to come, blessings in your life. But you just have to give it a chance. You just can't lose hope and you can't give up. And remember, favor ain't fair. So, I leave you with that, and I see you tomorrow morning for the 10:30 hour of the Diana Wright Show, and it's wellness. We're going to talk about that. Lots of stuff to talk to Dax about and lots of challenges to deal with. And also, remembering now that we are going on hiatus as of next Tuesday morning, and we'll be back in August, sometime at the end of August. And so, it will give you a chance to go on my website and watch all the shows that you've missed. Because lots of you probably have missed a lot of shows. And we're up to 160 something shows. And if they're not on my website, they're certainly on YouTube. And just take a little patience to find it on YouTube. Go, join, sit down, just the way you go over all those series that they have on television. You sit down on a Saturday and you watch them all. You can do the same here. You can watch it on your iPad, your iPhone, your smartphone. You can watch it on your computer, your desktop, anything. Just join me, watch the shows, catch up on what you've missed, tell a friend, commiserate with someone about some of the things we talk about here to try to help you to be the best you that you can be. So, once again, thank you so much for joining me from around the world and in the United States. This is the Diana Wright Show Live, and we will see you tomorrow morning at 10:30 as we go into wellness. Have a great evening, and as I say, ciao, au revoir, and adios. If you love something, set it free. If it comes back, it's yours. If it doesn't, it was never yours. Don't forget, April 30th is I Love Me Day, International I Love Me Day. It is crucial to love yourself. And that simply will get you out of your depression, your rut, feeling bad about things about you. It will get you out of that if you love who you are. So promise you'll do that. Stay prayed up and be blessed. Dooby 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 doo 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 doo.